Okay, a very warm welcome and a good afternoon from the Charité in Berlin. I am very happy that we have the opportunity to organize a hybrid event. This is an event together with the Alliance Against Health Risks in Wildlife Trade and the sector project of GIZ, Religion and Sustainable Development. The title of this expert talk is Preventing Pandemic Risks in Benin, Cooperation with Religious Actors in Health. We will have about 1.5 hours time. And before we get into the presentations, I will introduce the experts here on the panel. But before we start with this, I want to give you a very brief understanding about what this topic is going to be about today. It's about Benin. Benin is a country, a very big country in West Africa. And it is a country where Voodoo is one of the state religions deeply rooted in the country's history and culture. And we will look at one specific aspect, which is the Voodoo practices, which also sometimes involve wildlife products. And let's say from a more broader scientific medical perspective, this also can involve high health risks because of pathogen spillovers from wildlife to humans. Before I hand over for the welcoming remarks, let me maybe give you 2 or 3 technical remarks. So we are well aware that you are out there in the virtual room, and we have Paula who will be backstopping. So if you have questions, we would kindly ask you to post them into the chat. And also when we have at the end of the presentations, we will have space for discussions and questions, and your contributions would be very much appreciated. You can give your contributions either by putting them in the chat or by raising your hand and then turning on the mic, the camera, so that you can present your question. Good. As I mentioned in the beginning, this event is organized by the sector project Religion and Sustainable Development, together with the Alliance Against Health Risks in Wildlife Trade, which at the moment is the secretariat of the Alliance is at the moment hosted by GIZ. I will give you 2 or 3 brief remarks about what the sector project Religion and Sustainable Development does. We work with GIZ projects on religious actors mappings, and that's why our cooperation here with the Alliance comes in, because Voodoo is also a recognized religion, and we will be looking at the practices here. So we have the instrument of religious actors mappings, but we also do a lot of other things. And here I would like to reach out to my GIZ colleagues to encourage them to join our community of practice Religion Matters if you have more questions. Paula will be posting in the chat the link how you can join. But otherwise, I don't want to spend too much time, and I would like to present the experts on the panel. First of all, we have Dr. Ange Jadouletron. He is head of the National Reference Laboratory for Hemorrhagic Fever in Cotonou, Benin. And he was an indispensable person for the so-called contact mission. We will in the presentation of the project explain in more details what the contact mission is about. In addition, thank you very much for coming all the way from Benin, I believe.
Thank you. Yeah.
Great, thank you. Then to his and the virtual team to your left, we have Professor Felix Drexler. He is here from the Charité Universitätsmedizin Berlin. He's the head of the virus epidemiology laboratory and an associate professor here. And he spent time working in Germany, but also in Brazil and in the Netherlands. And he has his focus on the evolution and epidemiology of emerging viruses at the animal and human interface. Thank you for coming, or actually you're hosting us, so thank you for hosting us. Then we have Professor Ulrike Beisel. She is a professor at the Freie Universität Berlin for human geography and geographies of global inequalities. And she also had a key point in the contact mission, and her team and she focuses on investigating the livelihoods of hunters and other actors along the wildlife and bushmeat trade chain. Thank you for joining us. Last but not least, we have Dr. Michael Nagel. He is the head of the GIZ-hosted Secretariat of the International Alliance, and he is a clinical microbiologist and has worked for many years as a laboratory director in various African countries. And he was also heavily involved in setting up the laboratory for hemorrhagic fevers in Cotonou. So I guess you and Dr. Ange, you have a long work relationship. Yes. Thank you very much. I would now hand over with the welcoming remarks to Michael. Thank you very much.
Thank you so much. Those kind words, and thanks for welcoming us to the Charité team, obviously. Also, thank you to Ange and to Ulrike Beisel for joining us for this expert talk today. Very happy to do it together with our colleagues from the sector initiative. From our global initiative perspective, it's very, very useful, and I'm absolutely amazed also that we were able to perform such an event. The International Alliance was commissioned by BMZ in 2021. It was a clear goal to minimize the spillover risk, definitely, and to minimize the gap between science and implementation. And so over the years, it became further elaborated, and so we decided to open a special program for governments to offer help just in case there should be something that governments would like to address directly to the International Alliance. And that is the moment when the contact initiative or the contact idea was born. And among the first applicants was Benin. It was the Minister Benjamin Compatin himself who applied directly to the Alliance, explaining that there might be a problem concerning bushmeat consumption and using bushmeat for various other practices. And I believe those are the perfect words now for Ulrike Beisel to start with your input. Thank you.
Thank you very much. Yes, I will report back from the social science component of an interdisciplinary research project that Ange, Felix, and I, with some partners that I will introduce in a minute, conducted in 2024 and 25. And the idea was that we team up and have a look at spillover risk of pathogens relating to bushmeat. And I will first present now some of the social science results, and then I will hand over to Felix and Ange for some of the natural sciences background. But first of all, I have to introduce the team. So if you, yes, thank you. So most of the work was actually not done by myself, but rather by Dr. Kamal Donko, who you can see here on the slide, who was a research associate at the University of Bayreuth and also works for the Research Center Lastel in Benin. And he, together with Professor Martin Dövenspeck from the University of Bayreuth, and Arvid Renger, a member in my team, he's also here today. We've been conducting the social science part of this project. And if you go to the next slide, here you will have a very short overview of the methods. We were working with a quantitative survey and then mainly qualitative interviews with over 100 actors. The idea was that we're trying to understand the whole supply and value chain of bushmeat, and also its regulation, but also, as you will see, the attempts to bypass regulations. So interviews were conducted with hunters, with intermediary traders, that means people who are bringing the dead animals or the meat to either urban markets, in some cases also restaurants. And then we talked with the market traders themselves, but also the local authorities, and then the restaurant owners and chefs as well. And in addition to that, participant observation was conducted in 5 communities in Benin, spanning mostly northern areas, also areas with either proximity or lying in national parks. So we had areas that were protected in themselves as well as part of the study area. And last but not least, there was also an analysis, of course, of the legal and institutional frameworks. And in the next 5-10 minutes, I will give you a little bit of an insight into some of the results. And I will start off with talking about what is actually bushmeat. And I mean, what we found in the research and what is also built in the literature is that what is considered bushmeat is actually really a wide and very fluid category. And in the widest sense that all of us will have encountered as well, it's just meat of animals that are living in the wild, right? Of wildly living animals. So that can cover a huge variety of animals. You will see that also, and also a huge variety of purposes, using animal bodies, both in terms for as a food source, but also in terms of different kinds of commodities, right? And what was our research interest? In the social science part, we first wanted to understand what is actually hunted in those communities in Benin. There are legal and illegal hunting practices going on, legal and illegal animals targeted at the hunting. Then we wanted to understand for which purpose is hunted. As I said, food, commodity, there's also ritual usage of animals. And then a crucial question for us was, how is bushmeat hunting and then trade regulated, and how are the regulations, I put it here as lived, which means are they adhered to, are they circumvented, are sort of rules and laws broken, and why, right? Because we figured that if we're understanding the whole sort of social life of this commodity chain of bushmeat, we'll get a bit closer to answering the question of how can we improve both biodiversity outcomes in terms of survival of certain species of bushmeat, but also how can we start to understand how health risks are created for people who are consuming the bushmeat, and also importantly, who are handling the bushmeat. Right, so let's move on. So you can't read this table, I'm fully aware of that, but I still wanted to give you a bit of a flavor of both the diversity of locations that we sampled, that you can see here in the first column, but also of the diversity of animals that are being hunted in Benin. And so you will see here, I'm not very close to the presentation, but you can see here that it starts with elephants and moves over monkeys, snakes, various smaller animals as well, antelopes, there's a huge variety of animals that are being hunted. And what you can see in the other column is what it's hunted for, which is also very interesting. And I already told you a little bit, but I just wanted to give you a few examples, and that is focusing on snakes. You can also see, this is a picture of one of the local markets that you can see here. You can see various animal parts here. Maybe in the middle you can see that there's some monkey heads there, and there's also a snake visible in the picture. And what I wanted to just quickly focus on is snake skin and animal heads are hunted both for artisan and also spiritual purposes. So our interviewees told us that to the snakes there is protective and healing properties ascribed to, and they are also used as a food source in certain regions. So this is also an important and interesting part, that spiritual usage as well as commodity usage mixes with food usage, right? So the practices of one animal are not sort of categorized, but they're all going beyond, right? So they're hunted for different kinds of purposes at the same time. There's a certain multiplicity there. So for instance, which kind of snakes are hunted for these purposes is the black mamba was mentioned, the Saharan sand boa, and also the royal python. And important to say here as well is that in terms of the broader bushmeat, that we've seen a growing economic importance of bushmeat as a food source. It's been an important food source for a long time. That goes back to colonial land practices and deforestation practices. It also has a big poverty has a big impact on it. So there's really a very important role of this huge category of bushmeat in terms of protein source, as a protein source for the local population. And what is remarkable is that also in cities, the importance of bushmeat has been growing. And I think it's not just Benin where this phenomenon has been documented, but also in other locations in the literature. And with that, I would move on to 3 short results slides. And I'm starting off with the spiritualities. I've brought you a few core quotes from some of our qualitative interviews. And you can see here, I will just read it out and then speak a bit to it. So this interviewee says animal species are protected by myths, taboos, and other barriers passed down from generation to generation. It was our ancestors who organized this so that animals would not disappear. So this is really important in terms of thinking about biodiversity and conservation as well, right? So that there's local regimes and practices that are enacted and still have importance, that are not just in the realm of a religion or spirituality, but serve a really important role in terms of how one lives together with the natural environment and with animals in that regard, right? And here's an example about a monkey. So one of the interviewees said, when a resident of Kikele falls ill, a marabou monkey also falls ill. And when someone dies, the corpse of a marabou monkey is always found in the forests. So this is just one of many quotations that we have from our interviews that show that there's various connections made here between the health of animals and the health of the people who live with them or close to them. That's why I've put the heading Changing Spiritualities here. we also had a very strong current in our research that this is actually changing a lot, in particular when economic pressures are coming in. So this is what the next quote speaks to. Here, the interviewee says, these animals are now consumed in certain areas, such as Charu, even in Basila, the protection system used by our ancestors no longer impress people. I find that a very nice way that the interviewee put it, because it shows that it's not necessarily that people don't believe in it anymore, but they are not acting according to it because other demands on them are considered more important, right? And indeed, the quantitative survey that we did also showed that roughly 45% of Basila inhabitants, as an example, are eating what is considered illegal bushmeat at the moment. And 10 years ago, this was roughly at 20%. So there's definitely an increase visible. And yeah. With that, I will move on to the hunters and the hunting and the trade. And this was actually what we focused on mainly. And I'm just looking, actually, there's two more things that I wanted to point your attention to. You don't have to necessarily go back, but just to say that obviously it's not at all snakes only, right? But important are, for instance, also the Sitatunga antelopes. You will see their fur on one of the pictures as well later, that are imbued with spiritual meanings, and are also pangolins who are really at danger in terms of their numbers now. And so just to emphasize again that both the hunting and the meanings ascribed to it are covering a wide range of animals that we need to look at in terms of understanding the importance of bushmeat, but also the importance of hunting. And with that, we move over to hunting. So as you might remember, we've done interviews with quite a number of hunters, but also interviews with local authorities. And I don't want to dwell on that too much, but just to say that the general legal framework, as this interviewee here is also recounting, is the Beninois Forestry and Wildlife Code. And hunting is regulated mainly in seasons, with the dry season being sort of the hunting season. And it's prohibited in the rainy season between June and October, roughly. And there are, oh, now the slides are somehow gone. Yes, we are back. We just need to go a few further. Here we are. And of course, there's fines and even prison sentences for offenses happening, right? So there is actually a quite good legal basis for regulating bushmeat and hunting of bushmeat. If you go one slide further. And because this is where it becomes quite interesting from at least our perspective. And one is that there, as a result of clashes, mainly also in the north of the country, the carrying of firearms has been banned, and this, of course, has become was quite a challenge to hunters, and there were a lot of sort of negotiations and also tensions going on around the carrying of weapons and also hunting firearms as a sort of background to that. But also we were very curious in our interviews about how are these hunting bans lived, because as I emphasized already, there's quite a big economic necessity and also food necessity for people to actually hunt and also live off bushmeat. And what we found was very much that there were a lot of informal routes and practices present where people negotiated locally to work with or around these official regulations, right? And the second quote shows this. Once cohabitation has been undermined, and this refers to this harsher regulations of firearms, but also of the hunting practices and the reinforcement. The collaboration became impossible. We find ourselves in a fool's bargain where at night on the hunting ground, friends by day become enemies. So the hunting has been driven a little bit more into a sort of illegalized space, one can say, but and how is this negotiated is very often with different kinds of routes and really actively evading obvious roads and points where maybe controls would happen, right? And this is what that last quote shows. Once the game has been hunted, this hunter tells us the meat is butchered and transported along rural roads to evade water, forest, and hunting officials. And at this stage, motorcyclists are called upon to assist. So there's active practices to still enable this this trade still happening, right? And I want to emphasize here really that the emphasis, in our opinion at least, shouldn't be on reinforcing and tightening these regulations, but rather on thinking carefully about how one can work with the local needs and the economic needs of the hunters and the people who depend on this trade, while at the same time, of course, think about the health and also the biodiversity implications that the hunting has, right? And with that, I want to come to my last sort of results slides and focus a bit on health and hunting. And here you can also see that hunters clearly have recognized that handling animal bodies involves danger. There's also an active knowledge system of knowledge passing on, including also WhatsApp groups between hunters and chief hunters passing on their knowledge and their practices to keep hunting safe, right? And here's one of the descriptions of how you can keep the handling of the animals safe. So this interviewee says, as soon as you shoot it, you make an incision into its sternum, but first you protect one of your hands with a handkerchief. If the hunter doesn't have one, he tears his shirt or pants to wrap around his hand. He then plunges his hand into the incision, locates the animal's heart and rips it out. He removes it carefully and ties the piece of cloth so that no flies can land on it. This is just an example. It then also continues to actually talk about the risk of flies and of infection that then happens. And with regards to sort of the later stages of the chain of producing then edible meat, right? That second quote speaks to safety practices that I would hope that also our natural sciences colleagues would approve of, because they say the meat doesn't have any illnesses. Well, but the interesting part to me is this: you just need to boil the meat thoroughly, that's all. In the worst case, add some chili, pepper, or fry the meat, right? So there's clearly practices there that are designed to keep people safe in handling this meat. And I also want to emphasize that often these are also very ritualized, right? So there's strictly prescribed gestures that regulate how carcasses must be opened, touched, washed, transformed before they're entering also domestic spaces. The danger is seen to be coming from either the contact between the deceased animal's organs and external elements, flies that are mentioned, or from blood drying on the carcass. And certain animal parts are also described as intrinsically harmful, we have found. Okay, so to quickly wrap up, from the social science side, our recommendations would be to, first of all, to take these traditional knowledge systems seriously and try and work to integrate them very actively into conservation and biodiversity strategies in these locations. And this always needs to involve local communities in order to establish trust, but also legitimacy. And I think that examples with sort of bypassing rules and regulations shows that quite powerfully, that this need to actually work also with the need for, in particular, economic demands, right? And so if then bushmeat hunting and trade needs to be regulated down, there needs to be a conversation about economic alternatives that could replace hunting as a, here it's put quite starkly, as a survival strategy or as a subsistence strategy, right? And what our interviewees mentioned also proactively was to support ecotourism, also to connect tourism to maybe traditional knowledge systems more closely, and also practices of sustainable agriculture. If you wanted to strengthen the regulation and the surveillance, then there was an emphasis on digitization that could have a big impact. And we also found, I didn't put an emphasis here, that the meat doesn't necessarily stay local, but there's an active cross-border network also of trade with bushmeat. So it needs to have a transnational, regional approach in combating. Thank you very much.
Yeah. Okay. Yeah. Thank you very much, Ulrike. That was truly very rich on information, but also very interesting that we could already touch on the, let's say, the more social aspects, because that is something that is sometimes neglected. But I think that's also a good handover to have a better look at the medical perspective. So maybe Felix, if you want to come in. Thank you.
Sure. Thank you, Irina. Yeah, thanks also, Uli. Impressive work, very, very rich, as said. So spontaneously thinking how to connect this, I think I best start maybe with what is well known as diseases from wild animals in large parts of sub-Saharan Africa, and especially for West Africa, Lassa fever comes to mind, which is also the major focus of the laboratory, the raison d'être of this hemorrhagic fever laboratory. Why does a country in West Africa have its own reference laboratory for hemorrhagic fevers? Well, because of Lassa fever. And this is, I guess, Lassa fever is well known in the region.
Yeah.
And many people will know it's somehow linked to wild animals, to some rodents in particular. But then we could open a lot of questions regarding which rodents actually would transmit or are source of that disease, because it's by far not every rodent that transmit this disease that indeed can be very serious and kill people. Right now, there is a Lassa epidemic in Benin and in Nigeria probably as well, because as Uli said, there is the trade and the value chain and the supply chain does not stop at borders, and neither do the pathogens, because the hosts also do not respect a lot the borders. And these rodent populations and the pathogens such as Lassa, virus carried by them, is also very fluid across borders. And still, despite this all may seem very logic and very non-surprising, but at the same time, it's not easy to mount a transnational response and even surveillance system. So from what we have seen over the last, well, more than a decade of work, and Michael has a long history in strengthening laboratories for hemorrhagic fever diagnostics, this is not easily done because the governmental actors, the countries don't necessarily find a need to harmonize actions. This is in part linked to the short term of election, so people will be in power for 4 or 5 years, and they don't easily win votes or popularity by implementing regulations against such things such as consumption of wild meat. So one of the lessons is that when we started working with GIZ, is that it comes to, one realizes that in terms of the funder, the ideal solution for them would be say a research project with an implementation, but also research component resulting in, for example, a governmental ban of bushmeat consumption. And I fully understand that. It's just not really easily implemented, because it's neither in the interest of people, nor necessarily, if they don't follow the logic behind it, it's not something that you can communicate via a research article that indeed lay people, but even people in different research communities will not read and not follow and not find interesting. But as I said, it's also not in the interest of governments. And I vividly remember one of the meetings we had with the Minister of Health when we were in one of the missions on site, to understand also the priorities of the minister, who on the one hand fully embodies all the necessities to protect its people and to bring health to his people. He's the Minister of Health. At the same time, clearly laying out the need to avoid, say, over agitation, to avoid a scandal message. For example, very, very precisely telling us that there is no interest in having premature calls for dangerous pathogens here and there that would not be good for the economy of the country. They would not be good for tourism. And this is all something that is maybe not that known to people out doing research into dangerous viruses such as Lassa virus from say an outside perspective. And you start, and at that point you start thinking about the name itself. Why is Lassa fever called Lassa? Well, it's a place in Nigeria. Many of those viruses are actually traditionally named by geographic locations: Ebola, Lassa, Zika virus. So pathogens or diseases that many of you in the audience will also have heard of are actually they were named after the place of initial discovery. And that has been common practice, but that does not mean it's correct. And nowadays, a minister or a government representative asking GIZ for support in together doing the next step towards a healthier interaction with the local environment. These things are also on the table. So you have all the supply chain laid out by Ulrike. You have local knowledge about some pathogens and hosts of those pathogens, but not others, because there's the big unknown that really nobody is looking into. Well, we are, and I don't want to go into technical details on individual viruses here unless you are interested and we find time. But also we have the economic situation. We have in terms of tourism, and we have a clear need to respect boundaries also on the government side. People reach out, and I personally think that it's great that the German government is funding GIZ to interact in a sensible way with local actors in a bilateral fashion. I think this is a great achievement of German cooperation funding with a focus on bilateral action, because in my experience it's very rich and very fruitful, and can bring a lot of results that maybe multilateral actors, which by no means are dispensable, cannot reach necessarily on the same level at the same pace. But we need to understand these steps, and the good thing is that if you are engaging in a setting such as within this defined project, you can actually get very frank replies from people. And I think this is a great achievement. And for Lassa, for example, we did get to a very, so for the known pathogens such as Lassa fever, it's very easy to reach common ground and to find ways to support diagnosis of Lassa virus, and not only in one region. And this is also a particular point. The social science team was active across Benin, and so is the virus diagnostics and the sampling of wild animal meats is not in the project was not focused on one region alone, but it has a network component. And to close this, we also have this strong interest and make this happen to transform discoveries into diagnostic tools that can support individual level, so patient health on the ground, and public health. And the reason being is that it's one of the lessons, maybe the pandemic made this hopefully somewhat clear. The tools we have for diagnosis of pathogens are frequently made by actors in affluent settings in countries of the global north. And those tests are not usually validated for use in countries of the global south, which may have slightly different pathogens, and then suddenly the tests simply don't work that well. And that's still quite a surprise to many actors in the field. So one solution does not fit all countries and all people. That's one thing, and not all pathogens. And the other aspect is, and with that I close, Uli has mentioned the economic pressure on people, driving them or affecting the way they interact with and consume meat as a source as a necessary source of protein. Well, the same thing applies to tests. So we have a strong economic pressure on diagnostics. Even here in Germany, we are in Charité, one of the biggest, if not the biggest university hospital in Europe, one of the top 10 hospitals worldwide. And trust me, it's not easy to just say, let's test our patients for everything there is.
Yeah.
Because that means economic pressure, which is on the system in Germany, a very rich country. So what I'm saying here is that the testing, even if we agree that testing for Lassa virus is important, it doesn't mean that we have sustainable solutions to do this on the ground in a sub-Saharan setting. Even having a reference laboratory that is very well equipped and very well trained and has a long tradition in doing so, it's not easy. And the pandemic has laid these deficiencies bare, because it's not just that vaccines were somewhat later available beyond maybe the top 10, the top richest countries developing those vaccines for COVID during the pandemic. That was the case, indeed. The same applies to diagnostic tools. And Africa CDC and all other African laboratories were waiting until somebody would grant access to critical reagents which are not locally produced. They were not locally produced. They still, to some extent, are not locally produced. They were not available. And again, this is me saying or pointing this out as an example. It's just the same for those pathogens from wild meat. There is no way that a company or an industrial actor from beyond sub-Saharan Africa would see a market in a rare bushmeat or wild animal meat associated pathogen or disease. Not easily so. And I think this is something we should consider when we conduct such projects as actors outside of the local setting. And we have a strong interest, but we are just a small fraction of people working with pathogens. So in that sense, I'm very happy with the project. It's in a way, our project with GIZ has ended, but our work has not ended. Yeah. We are still actually analyzing samples. It's not that easy. It's not that fast. And we hope to continuously contribute to pointing out needs together with our collaborators, and then to translate those needs into diagnostic solutions available on site. And I think we've gone a good way during the pandemic, and we will do so in that project and hopefully the years and projects to come.
What shall I say? Because it seems that Prof. Uli and you know better Benin than me now. Let me put some few remarks. You mentioned Chauru in your remark. I think Chauru is a big district where many hunters in the country are living because of wild animals. And people depend on these activities. I remember 8 years ago when Benjamin Mpati came as Ministry of Health, we welcomed him about a Lassa outbreak. He was very angry and he said, "Ange, why welcome me with this outbreak of Lassa fever? We think that is a disease coming from Nigeria." So every year Benin has outbreak of Lassa fever, and we think that it's coming from Nigeria. But since we started collaboration with Germany people, let's say with Micah, we realized that we have our own strain of Lassa fever, and the reservoir is in Chauru. So I'm very happy that you point Chauru, which is the main hotspot of Lassa fever. And now we are working on it, but we cannot say it's the only one reservoir of Lassa fever, because Lassa, the virus, doesn't need visa to cross the borders. So today, I'm very happy to be part of this discussion to tell you some things about Lassa fever, and people cannot leave this activity selling wild meat, eating this meat, but in the meantime, they will come to the hospital or they will come to the lab, say, we are sick and people are bleeding, we have to do some things.
Yeah.
So we will continue during the debate, and then I can give more examples. Thank you.
Yeah. Maybe just to also wrap up what Felix and Ange, what you said, can you maybe also, you talked a lot about the different stakeholders in this project, which, governmental, but also the hunters, which was also mentioned by Ulrike. Do you think that the Voodoo religion or the priests and the priestesses can prospectively have a potential in mitigating such outbreaks? And maybe to ask on another level, do you think that the cooperation with them would lead to good results, or is that just too small of a factor within the whole, let's say, I'll say bushmeat value chain? This would be my question, which I would kindly ask to everybody of you.
But maybe
To all.
to answer.
Nobody wants to answer.
No. I want to answer.
Okay,
True,
good.
but
I think after you start.
okay, let me come back to the conclusion of the project we just finished. That before this project, most of the time the Voodoo people, they use wild animals for the ceremony. And yearly in Benin, particularly in January, we have a good festival of Voodoo. So people kill many animals for our ancestors to say, okay, we are with you, and then we have to feed you. But with this project, people realize that treating all the time animals without wearing the gloves or PPE, usually they are sick.
Yeah.
Also, the sellers who go to the market and work with the animals, they usually complain about the health. So now people are coming to the conclusion that it's better to leave wild animals and start using domestical animals like chicken to feed our ancestors who are hungry where they are. So it's very complicated. But this project tries to convince some hunters that wild animals is not too good to manipulate them, but they prefer, some are now preferring domestic animals, working with it, and we are getting good results. Because until now, compared to the result we obtained 5 years ago, we just have 10 positive cases of Lassa fever, which was not the case before this project. That means that hunters are understanding progressively what is Lassa fever, what is the consequence by touching directly wild animals. I don't know if you want to add something.
Well, yeah, and then maybe let's see what Uli thinks about my comment. I think what I think was very impressive is that to come back to Irene's question. So the priests and priestesses are extremely knowledgeable. During the discussions we had, and I did not have many interactions, but the ones I had were very impressive. Those are highly educated people, and that doesn't mean they have necessarily a university degree. I do not know if they have one, but they are very knowledgeable about many things, including diseases from wild animals. So actually, there were some mentions of rituals where they would rather use chicken as a safer source of meat and blood, because there is blood contact probably to some rituals, where they exhibited quite some care about how they would prepare the animal for the offerings and for the ritual. And that is me saying ritual. Of course, I did not have like I don't know the rituals, but the way they described handling the different animals was very insightful. So I would not see, so on the one hand, these are very powerful people, but there it goes to the social sciences. To one of the quotes, the question is, they're very powerful to whom? And that will be a question for change and for new generations to see if they still see this as an influential belief system. To me, and from how I saw how people were interacting with those religious leaders, was definitely showing quite some power to those people, definitely. And coming back and closing with this exposure question, those people, I think, are much less at risk than the people selling wild animals close to at the markets close to the roads. So there may be, say, an element of poverty here to be considered, in that the priests and priestesses are probably, say, on a higher level of influence and wealth, maybe individual wealth. At least they are in a, say, they're not as exposed. To me, that seemed to be the case, because many of the people I saw selling wild animals near the roads were definitely not well protected. There was, if you see, I mean, we're talking, when we say markets, it's not like if you go to Prenzlauer Berg in Berlin to a street market and buy cashew nuts for XY euros the kilo. It's not clean. It's not clean. It's on the ground. People wear no shoes. People wear no gloves while handling the meat is lying around. There is flies on the meat. You see birds close to the meat, so the kids have to scare away other animals to maintain the integrity of the product that is to be sold to people driving by. And we tried to, and so the project did quite some effort in educating, in exchanging on personal protection. The way that animals are prepared on those very rural settings is definitely not perfect yet. It's getting better, and the project did quite an effort in this. But what I'm trying to get to is that we have an economic component here, both in education, where we see huge differences, and in exposure. So in a nutshell, it may well be that we could imagine in follow-up work a much more tailor-made approach where religious leaders will certainly have a very different level of exchange with a project than people actually selling.
Yeah.
No, yeah.
Yeah, I mean, I think I would definitely say that they have a role to play, but there's also more than those actors. So there's the traditional chiefs as well, for instance, who play a really important role. They were, for instance, the head hunters, right, the chiefs of the hunting that played a really important role also in passing on knowledge, right? And there is an age determinant that we found. So we had in the surveys 70% of the over 50-year-olds were still very much invested into the protective rituals and belief systems, versus only 28% of the under 30-year-olds still put importance to that. So I guess that's a phenomenon that one needs to reckon with as well. Then there's this age determined. And I think in terms of protection, we clearly saw also in one of the quotes that I had on the slides, right, that people are very well aware that there is, of course, danger in handling animals, and there are practices and protocols and ways to handle, but as you said, very often the economic possibilities play a role. You saw in that quote that it was very improvised protection, right, of a t-shirt or something wrapped around your hands, and precisely not having access to the gloves, for instance, right? So I guess it's a yes, but we need to think it also wider, I would argue, and expand the social actors, but by no means not work with them.
Thank you.
Yeah, I had got a question as well, or a remark, and thank you so much about this. So what always made me wonder, so I came to Benin more than a decade ago during the Ebola crisis, the first time when I came to West Africa to see the lab of Dr. Yadoleton. And so in the end, it means it took us, this topic is very important, obviously, so to involve all relevant actors, to understand not only the pathogen itself in the lab now, but to understand the whole systemic approach. And it took us more than a decade to develop such an idea, that we were able to work together with Ulrike Beis, for instance, and Felix, of course, to implement something from the social science perspective, matching it with the medical aspects of virology in the field. And that, I gotta say, makes me obviously very proud, but yeah, it took a decade for us to understand that how important it is, obviously. So thank you very much.
Yeah, thank you also very much, Michael, for also highlighting the aspect of the, let's say, the innovative aspect of this project. I mean, it sounds very easy to link medical and social sciences together, but in a project, actually, as you said, it can take, it takes many years. Before we move to the questions, the Q&A session, I do want to give the floor to Dr. Ange, if you want to maybe give some more remarks, because you were a little bit quiet and you came all this way. So we would like to hear more from you.
Oh, okay. About this project or about the contribution of JZ in Benin?
I would leave that up to you. Maybe if it has a little bit to do with the subject of the title of the presentation, then that would be good, because otherwise we may lose some of the participants that we have in our virtual room.
Okay, briefly, let's say we are in 2026.
Yes.
Imagine that 2024, 12 years ago, Benin was unable to do the diagnostic of any pathogens, which was very dangerous.
Yeah.
We always sent our sample to Nigeria, and before getting the results, the patient would die. So it was very sad. So my country decided to contact the headquarters, say that we don't have this capacity to do the diagnostic of Ebola of Lassa. And immediately we received a response, and he was the one, Dr. Mikhail, came to Benin. He discussed with many health actors, and finally he met my boss. He was the Ministry of Health.
Good.
The only thing he didn't get in Benin is the passport.
Not yet.
So progressively we started, and today I can tell you that Benin is able to do the diagnostic of Ebola, Lassa fever, dengue, and we have the platform of the sequencing with Felix Dresser. Because we started with Lassa, and when COVID started, we was unable to do the diagnostic too. So my country addressed a request to GZ headquarters, and he was the one who came again. And he sent the team of Felix, and they came with reagent, with the devices, and everything started very well. I can tell you that during that time, we received more reagents than Germany people here, honestly.
Wow.
So my country was very, very happy, and he did a lot, and Felix also did a lot for my country. Imagine that every 3 months, some lab technician from my side will come to Germany to be trained on how to do the sequencing or how to do the diagnostic, and this is very important.
Yeah.
This lab is the reference lab of the country, so any suspected samples from the north of the country, they will now. Again, for MPOS, this is unbelievable. You can see many people with the symptom. We don't have the capacity. So anything I have to talk to my MOH, who will address a letter to GZ, and finally, then we send a mission from Charity to come to support us. Today, in 3 hours, we can do the diagnostic of MPOS and varicella and let you know exactly which clade is circulating in Benin. So thank you, Dr. Mikhail, and thank Prof. Felix for helping us.
Yeah, thank
This
you.
is what I will say for a moment.
Yeah, that was, it's not the closing words, but it was more of an encouragement. Thank you for also this very personal perspective and the contributions that were made. I would like to open the floor to our virtual, let's say, community. And as I said in the beginning, we have a number of experts here. I don't think we should let them go without asking them some questions that we have pressing. So anybody who would like to ask, feel free to raise your virtual hand and open the camera, or maybe some people, I think there were at least 1 or 2 questions that were in the chat, but let's see if somebody, yeah. Okay, so I will first give the floor to Paula, who is backstopping and has been having the questions in the chat. So do you want to read them out?
Yes, thank you, Irina. There were lots of questions in the chat. Some were already answered by other participants. I would like to start with Jamie Reeser. Jamie, might you switch your camera and mic on and ask your question to the panel, please? So, Jamie, if you're still with us, please, yeah.
Yeah, sorry, it's asking me for all sorts of permissions. Okay, thank you. So the question is, what is the plan to explore the recommendations through a participatory approach arising from the local communities, i.e. to try to avoid a conservation colonialism or a public health colonialism and environment in moving forward?
Me? No, thank you for that question and also putting it so well. And that's indeed why I emphasized both the need for local involvement, but also these very close connections to economic needs of the local communities, right? So the idea would be, and I think it's actually quite amazing to work with Ange and Felix on this, but also with Kamal and the partners who cannot be here today, that we're trying to really think carefully about how can we develop interventions that are not just there for people to be circumventing them because they need to, but rather to think about what is actually possible in terms of sustaining local livelihoods, but making them safe or safer, right? And this is particularly important in hotspots areas, such as Ange described earlier. So maybe I'll leave it at that for now.
Jamie, was your question answered sufficiently?
Yes, I mean, I think it's a long conversation in many respects to take that on, but I'm increasingly concerned about the imposition of Western values and economic models as solution states in the global South, recognizing the potential for the unraveling of cultural identities, cultural erosion, even when there's a very valid positive intent behind the conservation and or public health sector actions. So thank you.
Thank you, Jamie.
Yeah, I mean, obviously, this discussions around, colonialism and what kind of approach we have in development cooperation does not only touch upon projects that we're discussing now, but I think it's a cross-cutting subject that each and every project working in development cooperation should ask himself, herself. So I think, but it's very good that you brought this aspect up as well. Thank you very much, Jamie. Now we have the next person. Do you want to present yourself and also maybe tell us what your name is, because I don't want to, mispronounce your name. That would be a pity.
For sure, Korogona Odyssey is wrong pronunciation, but please correct me.
Korogon?
Korogone.
Korogone? Do you want to open your mic?
Yes, I was trying
Thank
to.
you.
Can you hear me now?
Yes, we do.
Okay. Good afternoon, everyone. Do you have translation? Otherwise, I'm not very fluent in English, but I can try to speak.
I think your English sounds perfect to us.
Okay, so I am Ulysse Korogode. I'm greeting everyone there. I'm from the Wildlife and Forest and Wildlife Department in Benin, but working with the Elephant Protection Initiative Foundation as a Director of State Engagement and Program Support. So I received this link from John Scallon, the CEO of this foundation. It was a very interesting presentation that you made, and I have a few questions. But first of all, I'm working with the Wildlife Department since a while. I know Dr. Kamal Donko. We studied together years ago in Parakou, but I remember that we discussed quickly on this study, but I'm not aware on exactly when this study has been conducted. And also, I'm not sure that the Forest Department was fully involved, because on the picture you display, I was not able to see one of our forester or someone doing the discussions, especially when you were targeting the law enforcement, because as you mentioned, every year we have this decree where we state on the period that we can the hunting period. But this hunting period does not really allow to have sufficient resources for the market. And also coming back on the table that you show, around National Park Penjari and the other national parks, all the species that have been targeted, been used, are protected: elephant, cheetah, lions, pangolin, baboon. All these species are prohibited from hunting all the year. Even though there is a hunting period, they are not allowed to be hunted. So that means all the products we have on the market, or all the product used for eating or selling, all these resources are coming from illegal practices. For the hunting periods, it's just allow people to be able to still be conducting the traditional hunting practices. So the small hunting, be able to just a rat or very small species. So this is not the way they are finding the resources for the market. And coming to that, I think it will be good also to relating to the traditional spiritual practices, as mentioned by Dr. Yaduleton, who I'm greeting now. He's my big brother. This for these practices, they are not using wildlife. They are using chicken, goat, cow, all these. Most of the practices in spiritual way is used to protect.
Thank you. I think you are breaking.
Can you hear me now?
Yes, but shall we hand over to Ange?
Okay.
Thank you very much.
Thank you, Korogone. How are you?
I'm good.
I'm very happy. Okay, I'm very happy that you know Kamal and some things about this project. I remember the time we decided to obtain the Nagoya project certificate. We submit all the documents to your administration, and Amandine, who was in charge of the department that time, participate. And at the end of the project, we organized a meeting at Cotonou, where many hunters were at Cotonou, and we present the result to them. David, who is very close to you, also was there, and many people from your department also attend this meeting. So I'm very sorry if we didn't invite you, but we invite some people in your department. But when I'll be back, we can talk of this project.
Okay.
Thank you. One bottle of beer and share and talk. Okay.
Yeah, thank you very much. Because by the way, I'm also the national focal point of the CITES. So, and all these species related to CITES. So but that is good. David Ayeyon, Amandine, they are all my colleagues I'm working with. So I think it's very good. So I'm saying that maybe if you want to involve spiritual practices for this project, it will be good, but it will be in terms of helping to protect, because and also working to reduce the demand. The big issue we are having now is not the small hunters killing animals to feed themselves, but sending the meat in Cotonou, Parakou, in the big restaurants, where now the young generation of coming from the north, for example, they want to eat their pounded yam with the specific meat coming from the wild. So they say, oh, on Friday or on Wednesday, we need to meet ourselves and go to this restaurant to eat this meat, specific meat. So we need to work to reduce the demand in the big cities, and this can be helpful to reduce also the threat on the wildlife species. So it's what I can just add as a comment. I will be discussing with Dr. Yaduleton once he's back to Benin, and I can be I'm available to help you for anything you need on the project. Thank you.
Thank you. Yes, please go ahead.
Yeah, so just from my side, thank you so much. And you raised some really important points and also some of the sort of shortenings that I had to do for this presentation. So first, in terms of the data collection that happened in 2024 mostly, and Kamal, whom you know very well, was the main responsible person for doing the interviews. So and then in terms of what you were saying, this is really important and super interesting. We obviously relied on the self-statements of the hunters, right? We didn't count any carcasses or found anything. So they were reporting to us what they have been hunting or what they know has been hunted, right? So, and as you said very clearly as well, this goes between legal, illegal. I had that very briefly in my presentation, but I didn't specify which animals. That would have just taken too much time. But this is a really important point that some of these animals are not allowed to be hunted at all, right? As you pointed out. And just very briefly to that last point, because I think it's really crucial. We also interviewed some of the chefs and some of the restaurant owners, and indeed this is the major new trend, right? That it becomes an urban phenomenon, that bushmeat is very much asked for, and this poses all sorts of problems. So it would be super interesting to continue the discussion. I'm sure Kamal would also be interested. Thank you very much for being here with us today.
Thank you. So now, so that we get the rest of the people who are asking questions now, Matthew, Shirley, do you want to turn on your camera and or your mic?
Can you hear me?
Yes.
No problem. I can't turn on my camera. I apologize. I'm on a low bandwidth connection. Yeah, my name is Matt Shirley. I'm the co-chair of the IUCN Pangolin Specialist Group. I was forwarded your presentation by somebody, one of our One Health team members, and so I was very happy to be able to attend. It's pretty good work. I don't necessarily have any questions, just so much as to let you know that the Pangolin Specialist Group, in collaboration with ZSL, had a not dissimilar project over the past couple of years funded by the U.S. State Department that was unfortunately terminated by all the shenanigans we're all too familiar with the Trump administration. But the major focus of the program was to understand many of the same things you guys were looking at. We didn't go so far as to do the disease surveillance specifically, but we were very specifically working with the traditional medicine traders and the raw products. This is all the stuff you guys are referring to, the vodoun religion and the traditional medicine practices on wildlife trade, and trying to assess both. Well, basically, adding to a very extensive existing body of literature in terms of what wildlife is traded and for what purposes in Benin, to kind of update that reference database, obviously communicating with a whole bunch of traditional medicine practitioners, both the doctors, quote unquote, themselves, the priests or priestesses, as you call them, and the actual consumers of that, and getting a sense for, what are the perceived risks, what are the actualized risks, how often have people fallen ill as a result of consuming these products or coming into contact with these products. You guys kept referring to bushmeat or wild meat, but there's a whole other massive aspect of wildlife trade in Benin, which is for medicinal products and traditional religious products. And those products are often preserved in much different ways than the meat, and it provides a different exposure risk to consumers and patients seeking them out. And that's where we were working on at the time the project got canceled. But the next steps of our project were to actually try to convene an interdisciplinary kind of stakeholder council that included the Wildlife Service, ULIS, in fact, the Ministry of Health, and all the different traditional medicine stakeholders, from the hunters to the vendors to the actual people developing the remedies and the consumers of those remedies, and seeing how we could all work together to both mitigate disease risk and also mitigate impact, or conservation impact or conservation threat on the threatened species, the many threatened species that are traded in those markets. And so just wanted to put that out there and say it would be really great to maybe link another time and chat with you guys a bit more closely about what you were finding, maybe share a bit more intensely our results in terms of what we're finding, and see what avenues for synergies there would be moving forward.
Yeah, thank you, Matthew, for bringing that in and also raising the point around synergies. I know that Felix has one immediate reply to this. I just want to put into mind we have another 7 minutes and we still have 2 more persons. So if you definitely try to keep it short, it would be great. Perfect.
Yeah, Matthew, thank you. This is all very important, and I would like to make a link between your comment and the one from Korogone, who said that from a wildlife department, from the Ministry of Wildlife, their problem is much less the small-scale regional hunters than which then culminated in Uli's confirmation of a sort of changing urban demand, right, for certain wild animal meat. For the pangolins, particularly, one of the things that I found very, well, astonishing and different from other wild animals I have seen sold and butchered on local markets is the presence of foreign nationals of apparent looking rather of Asian descent, acquiring pangolin components on those very markets. And I think I may be mistaken here, but I'm assuming there must be quite an interest of foreign nationals in pangolin products, which is probably contributing to it being, if I'm not mistaken, the most trafficked animal of Africa. Mm. So this is really, again,
yeah, for sure.
Right, because that means it's, again, not the problem of a local demand, be it for spiritual use or be it for consumption. It's a question of international illegal trafficking and need, right?
Maybe just if I
yeah,
can
exactly.
put in one point.
Just to be
maybe if I can just put in one point, yeah, this aspect of, let's say, proxy, you know, influences. I think in every project we need to put that also into consideration, because of course we have the local level, we have the national level, we have the regional level, but we also have all these international dynamics, which should not be underestimated in any project. So Matthew, if that's okay with you, we would now go to the next person, to the next question, because we have 4 minutes left.
Yeah, just very briefly, two quick statements. One, I put my contact information in the chat box, so you guys can be in touch with me afterwards. I appreciate that. And the second thing is, we actually had university researchers from Chinese universities looking at the Chinese diaspora consumption of these products as part of our project as well. And so we do have a lot of information on that. We'd be happy to discuss with you moving forward.
Thank you to Matthew. And now on to the next question that we would have.
So it was right at the beginning. It's Jim Seeger asked one question. Jim, was it already responded in a way that you agree with, or do you want comments? Okay, if that's not the case, then Hongying Li, please come in with your camera and mic.
Hi, everyone. Actually, I'm the One Health person Matthew refers to. I'm also part of the Alliance. So, so I'm very happy you are connected about this thing. So my role in that project is really looking at the One Health aspect of this traditional medicine use of a wildlife in Benin. One thing I want to recognize is wildlife, animals and plants, based on our research, it's a very important part of the healthcare system in Benin. So we do recognize that, acknowledge that. So that's what makes this One Health aspect very interesting for us, right? It's good for the health, but it could be bad for the health. That's one thing. And another thing is related to my question, because looking at the social behavior aspect, we're trying to identify the really high risk behaviors so we can really work with people. But then there's very limited evidence in terms of disease surveillance, in terms of genetic spillover evidence there. So make it very hard to identify the behavior. So I want to hear from you more if you have any other information to share in addition to Lassa fever. What are the disease you have been seeing, have been heard from people related to contact with the wildlife?
Thank you, Hong Ying. And it's quite funny that you are the person obviously in charge. And with the highest pleasure, of course, we're going to share the results with you and or whoever is interested in. We're going to see each other, as you know, in less than a month in Paris, and then we have enough time to exchange.
Okay.
With pleasure.
Good.
Yeah, putting the time into consideration, before I hand over my word to Michael, who will do the final wrap up, I just wanted to say that I think this format, bringing in let's say experts from different backgrounds and looking at different angles to tackle development projects, I think this was a format that was quite successful. So in this sense, I also thought it was very fruitful that we had, on the one hand, GIZ people working with GIZ, but also people who are members of the Alliance and other guests. So thank you, everybody who joined. But before you log off, let me hand over to Michael. And I want to say thank you to everybody.
Thank you again, Irene. And you already did the wrap up. So what's left to say, obviously, except thanking our excellent and wonderful experts here with us today. And thank you so much. It was a pleasure for us. And especially I would like to highlight, so also it means a lot to all of us, I believe, so speaking in the name of Professor Uli Balse and Felix Rexler right now, that Dr. Sotte-Breton was willing to introduce us to the very sensitive topic and theme of voodoo and religious practices in Benin. We know it makes us very proud that we were dedicated to see or to get deeper insights. Thank you so much. Thank you to all the audience. Thank you for staying with us. And today was, at least from the International Alliance Secretariat's perspective by GIZ, our very last expert talk. And so it will be taken over by the colleagues from VOA, and they will do a wonderful job from next month. So, but today, from GIZ perspective, it was our last call, and it was our pleasure to do it with you. Thank you so much.
Thank you.